Welcome to the WRAL Daily Download. I'm Grace Holland. Last week, a 2-year-old died during a routine dental procedure. WRAL Investigates has been reporting extensively on deaths from dental anesthesia over the last few months. Sarah Krueger joins me to talk about what we know about this latest case and the push for accountability. Sarah, thanks for being here.
Of course.
So, this was really making the headlines around our state last week. What happened to this 2-year-old little boy?
Yeah, so his family talked with our news gathering partners in the triad, WXII, and gosh, so heartbreaking just to see the sweet little boy's photos. But apparently he was at a surgery center, an oral surgery center for a cavity surgery, and just didn't make it out alive. According to the family's interview with WXII, he was a healthy little 2-year-old boy. He went back for what was going to be a cavity surgery, and it was going to involve some anesthesia. And then according to the family, the nurses told them that his lung collapsed and never made it home, went by ambulance to the hospital. And the family, of course, just has so many questions. Nobody ever expects to go in for a fairly routine dental procedure and have this result.
Right. And what is the history of the dental office where this happened? Have you uncovered anything about them?
Yeah, so I reached out to them with, a number of questions, and they sent back a statement that didn't answer the questions, but it does talk about, how their staff includes, it says, an array of highly experienced and board-certified physician anesthesiologists, certified registered nurse anesthetists, and nurses. And it goes on to say, our professionals are dedicated to providing a caring, nurturing environment where comfort, dental health, and safety are of primary importance. And it says since 2019, they've seen more than 13,000 patients successfully at their center. So this is Valley Gate Dental Surgery Center is the name of it in Greensboro. But I looked at their website. They do have locations all over the state, including in our area in Fayetteville, and one that says it is opening this month in Garner.
How often do deaths like this happen, according to the State Dental Board, in some of your previous reporting on this topic?
Yeah, so this is something that's been on our radar for months. As you mentioned, we've done a number of stories about deaths related to dental anesthesia just because we had noticed more of them. And according to the State Dental Board, there have been at least 8, prior to this incident, there had been at least 8 deaths statewide related to dental anesthesia in the last 13 years. So, it's still not something, thank God, that is happening all the time, but that number, still gets the attention of a lot of advocates and activists who just are really hoping for change and believe that this is a totally avoidable tragedy.
And I know you've spoken with families that have been affected by this. How are they reacting to this latest case?
Yeah, so there have been 2 other families that I have spoken with over the months, including, just recently in putting together this story, who lost loved ones that was later tied back to dental anesthesia. One of those is Sheetal Patel, her husband, Dr. Henry Patel. He was a cardiologist in the Wilmington area. He died after what was supposed to be a routine dental visit in 2020. And since then, Sheetal Patel has really made her mission, raising awareness about dental anesthesia and the dangers, and really pushing the state's dental board to put in place stricter guidelines surrounding dental anesthesia. And she talks a lot about how her husband, as a doctor, he would never have been able to administer anesthesia on his own. It would have required an anesthesiologist, that's how things work in a hospital setting. And that's one thing that she believes should also be the case in dental settings, that there should be an established second provider devoted to dental anesthesia. And she has pushed for that to be a change in dental board policy. And so far that has not yet happened. But, I talked to her again as I was putting together this story, and she just said, this is exactly why I push for these things. This is why I keep fighting. And I will say we don't yet know in this case what the anesthesia protocols and policies were at this particular center. That was one of the questions that I asked them, and which they did not directly answer.
Okay, let's take a quick break right there, and we'll be right back. Sarah, before the break, we were talking about this really just so sad case out of Greensboro where this 2-year-old little boy died during a dental procedure. And there's still a lot of questions about what exactly happened for him to die. But as we wait for those answers, what has the dental board said to you about this latest case when you reached out to them?
Yeah, so I talked to the CEO of the state dental board, which is the organization that oversees dentistry and really establishes the rules for dentistry in the state. And they are investigating this incident. But at this point, it's still all very in the early stages, but their understanding so far is that it was not a dentist who administered the anesthesia, and that the dental procedure itself, like the dentist's work on the cavity, actually never began. So the complications arose from that anesthesia phase, prior to the official surgery itself. And I did ask the dental board CEO, depending on what your findings are, do you all feel like you need to reconsider, and will you reconsider and revisit your policies surrounding dental anesthesia? And he told me, yes, depending on the findings of their investigation, certainly that is on the table.
With this dental office, you got into a little bit already of how they responded and that there's still a lot of questions that you asked that haven't been answered. What are sort of the possible repercussions from them out of this?
So for the dental board, the dental board has the power to suspend a dentist's license, to revoke a dentist's license, or to, give any kind of a range of punishments. I've seen them in the past do things like, additional training or remedial courses. So I think, it runs a large range, anywhere from like training to just outright, revoking a dentist's license.
And you told us in your reporting earlier this year that there was a bill that was moving through the General Assembly that would change how the dental board is elected. What's the status of that at this point?
Yeah, so there has been some criticism of how the dental board is selected. Basically, right now, the dental board is selected by other dentists. They pick their own members. And that's gotten some criticism, including from state lawmakers who drafted this bill that would change the way the dental board is selected. And instead of being selected by their own, its members would be appointed by lawmakers. And that bill, Senate Bill 599, it did pass in the Senate, but it is currently being held up in the House. So, doesn't look to necessarily have the brightest of futures as far as bills go. But that is definitely one point of criticism from some lawmakers and from Sheetal Patel, whose husband died during a dental visit. She really thinks that it's problematic that the board that oversees dentists is elected by dentists and comprised of dentists.
Got it. All right. Well, a lot for us to keep an eye on. I'm sure we'll continue to talk about this. Thank you so much, Sarah. We appreciate your reporting.
Thank you.
And thank you for listening to the WRAL Daily Download and for making us part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. That's a daily email with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.